Hi, have you ever wondered how our feet are able to support us through everyday activities? Well, I'm a dancer who spends many hours on pointe shoes a week, so my feet are very important. We are going to look at the anatomy and the most common surgeries performed on your feet. Let's start by looking at the bones inside of your foot. Inside of your 1 foot and ankle, there are 28 bones. Some of these bones are your 5 phalanges, or 5 toes, your 5 metatarsal bones, which are the bones after your toes, and your calcaneus, which is in your heel. This is also the largest bone in your foot. You also have the tibia in your ankle joint that takes about 85% of the weight, and your fibia, which is the smaller bone in the ankle joint. Now that you know some of the bones, let's take a look at some of the ligaments in your feet. In these diagrams, you can see there are many ligaments in your feet. The most important ligament is your plantar fascia. It connects your heel to your toes. There are also muscles in your feet. They are put into 4 compartments that you can see here. They originate above the ankle in the leg but are inserted within the foot. You also have nerves. There are 5 main nerves within your feet. They are the superficia, deep personnel, tibia, cerebral, and the saphenous nerve. These nerves are derived from nerves that start at the lumbar spine. Now that we have looked at the anatomy of the foot, we can look at how it is classified. Your foot has 3 regions. The hind foot starts at the ankle joint and goes to the transverse tarsal joint. The midfoot goes from this joint and ends at the front of the metatarsal bones. Finally, the forefoot starts at your metatarsals and includes the rest of the front of your foot. Your foot is also broken down by 2 columns. In this diagram, the first column, or the medial column, is more mobile, whereas the lateral column, which would be the outer part of your foot, is stiffer. Now that we know the anatomy of your feet, we are going to look at the most common surgeries. You can have many surgeries on your feet, but I'm going to tell you about 10 of them. First is bunion surgery. A bunion is a deformity of the joint that connects the big toe to the foot. You need this surgery when this joint is not in a line. A bunion can be corrected by making an incision on the top or side of your big toe joint, removing some soft tissue and bone, and using plates and screws to hold it in place. Another surgery that is common with feet is hammer toe correction. A hammer toe is when a toe is always bent and does not straighten. A surgical procedure such as making an incision on the top of the hammer toe and either removing the whole joint or part of the joint will fix this problem. The next surgery is metatarsal surgery. This is very important because it helps to create a steady weight-bearing surface on your feet. During surgery, the surgeon might remove some of the extra hard tissue or some bone to correct balance. Plantar fasciitis is also a surgery performed on your feet. While this condition does not always need surgery, some of the more extreme cases will. The surgeon will detach the plantar fascia from your heel. Neuroma surgery is also performed on your feet. It is a removal of a benign enlargement of a nerve. The infected nerve is usually between the 3rd and 4th toe, but can also be between other metatarsal heads in the ball of the foot. The surgical procedure for this would be either to remove the nerve or cut the ligament that binds the bones together in the front of the foot. Another common surgery are fusions. Fusions are important because they join the bones together and stop them from rubbing. An ankle fusion is where the surgeon would roughen the bone edges and hold them together with a metal plate and screws. A toe fusion is also common on the foot. To fuse a big toe, make an incision on the back of the toe. This would allow the surgeon to clear the joint and put a plate with screws to hold it together. Tendon surgery is another surgery that I learned about. A patient might need it if they have torn a tendon either entirely or partially. Surgery can help by having a direct primary repair with stitches or secondary repair with a graft or tendon transfer. Reconstructive surgery is also performed on your feet. It is very important because it can help you regain function, increase stability, and help to reduce pain. Reconstructive surgery is used to do things like joint implants, bone grafts, skin grafts, and amputation. Nail and skin surgery is also very common for feet. Toenails can get damaged and destroyed, but they can be removed with a simple office visit. On your skin, you can get growths like lipomas, fibromas, warts, and rashes. Depending on the size of these growths, they will either have to be removed under general anesthesia or in the operating room. Finally, I learned about macrodactyly. Macrodactyly is when your toes are abnormally large. This condition is very rare and you are usually born with it. The surgery for this is very complex and usually has a few stages. First would be soft tissue debulking, and next would be a shortening procedure where they shorten your affected toes. However, if there is a severe case, the surgeon might have to remove the affected digit. Those are all of the surgeries that I learned about. I had a really fun time doing all this research and learning these really cool and amazing facts. I hope that you guys learned something, and thank you so much for watching.